Good morning. Thank you for joining us to learn more about COVID-19 in our county amid concerns about the Delta variant and rising case rates and spread of infection. In addition to today's press conference, we continue to provide daily updates on the website at publichealthsbc.org, through media and social media, a weekly report sent via email to subscribers. And just so everyone knows, the Board of Supervisors is on summer recess until August 17. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Del Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Mala Poe, assisted by Shelley Lawrence. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I turn it over to County Public Health Director, Dr. Vaughn Del Reynoso.
Good morning, and thank you, Gina. I'd like to start with some Epi Trends that we're seeing in our county. May I get the slides? So this is a graph that describes our case rate among vaccinated versus unvaccinated individuals in our county. As of July 19th, cases were 5 times more likely to be unvaccinated than vaccinated. The top line graph, you could see that describes the unvaccinated, and the rate is significantly going upwards. So as of 7/19, the rate among unvaccinated community members is 5.8 versus the 1.1 among vaccinated individuals. And this information is now available on the summary tab on our website. Next. Just to recap, as of July 26, our case rate stands at 8.8 cases per 100,000 residents. And to put it into context, that's a 400% increase since in a month, since June 25th. Our testing positivity has also rapidly increased to 5.3, with the testing positivity in the health equity metric areas at 7.2, and that is concerning that we are seeing a wider gap between the two testing positivities. Our active cases stands at 303, and that is a 70% increase from a 2-week average of 179. Our hospitalization, we have 28 hospitalized with 6 in the ICU, and that is a 71% increase from a 2-week average of 16. So as you can see, our numbers are increasing and increasing in a very rapid manner within the spans of 2 weeks. Next. Previous. So the vaccination rates, I'd like the previous slide. There you go, thanks. So this graph describes the vaccination progress in our county. So as of July 25th, we have 69.4% of our eligible community members vaccinated with at least 1 dose. And of that, 61.3% is fully vaccinated. To the right, the bar chart, we are still seeing lower numbers of vaccination among the lower age group. And we are working with our community members to increase that. So the 33% describes vaccination between the age group of 12 to 15. Next. This Excel spreadsheet describes the vaccination rates by zip codes. And so we have, this is also on our website, linked to the state open data source. So we have zip codes, we have our county by the zip codes, and the vaccine equity metric area, the 1 to 4, the quartile 1 describes the least healthy community condition versus quartile number 4, having the most healthy community conditions. As you can see, by the numbers of persons still unvaccinated, we have roughly 149,683 eligible people in our county still unvaccinated. So we have our work set out. We will continue to work with community partners to vaccinate individuals in the health equity metric areas 1, 2, and 2. This graph describes our efforts in the mobile vaccination program. In the 15 weeks that we have been operating, we have had over 200 mobile clinics supporting neighborhoods, churches, parks, farmer markets, swap meets, and businesses. We have offered a total of 12,202 shots to community members. Next. With regards to vaccine outreach, as I have shared with you, we still have a significant number of our community yet unvaccinated. So we are partnering with the 23 partners throughout the county to conduct activities such as door-to-door canvassing, social media posting, network outreach, PSAs, webinars, and incentives. The partner organizations are reporting that they are finding one-to-one conversations to be the most effective at convincing people to get the vaccine. Many partners have hosted multiple mobile vaccination clinics, and I'd like to highlight our partner Acme Hospitality this morning. Acme Hospitality operates 8 restaurants and 2 wine shops in our county. They have about 300 employees, and they want to ensure that they can achieve as close to a 100% vaccinated workforce. So they are partnering with our mobile vaccination program to do yet another on-site clinic for their employees, and even offering a $5,000 grand prize for a raffle. And so this is an example of businesses partnering with public health to ensure that employees are vaccinated. Next. Yesterday, the state announced a new state health officer order for masking and testing for healthcare. So this applies to unvaccinated employees in acute care and long-term care settings, high-risk congregate settings, and other healthcare facilities. The health officer order was issued yesterday, and to be effective on August 9th. More operational details will be coming from the state, and the state intends to release a frequently asked questions to address many of the questions that have come forth. And that ends my update this morning, and I'd like to introduce Dr. Ansorg, our County Health Officer.
Dr. Ansorg, before you speak, I just wanted to let everyone know that we are having some technical difficulties. We apologize for the sound issues. We're working through it, and videos will be available after the press conference. Thank you. Go ahead, Dr. Ansorg.
Okay, thank you, Gina. Thank you, Dr. Dorenoso. Good morning, everyone. I'm saddened to report that Santa Barbara County is experiencing a dramatic increase in new COVID cases, hospitalizations, and deaths. I'm particularly saddened and upset because all of this is 100% preventable. The way to prevent this is by getting the very safe and effective vaccine that's easily available. As the Public Health Department, in collaboration with our healthcare partners and outreach organizations, we are going above and beyond to reach every nook and corner of the county and in our communities to offer the vaccine to people. We make it as easy and as accessible as possible. And still, way too many people are unwilling to get vaccinated. Let me be clear. This new surge in cases, hospitalizations, and deaths is affecting the people who do not get vaccinated for whatever reason. We now experience a pandemic of the unvaccinated. It is unnecessary and completely preventable. Our elected officials, religious leaders, public figures in sports or entertainment, and other prominent individuals have a responsibility to step up and urge people to get the shots. It is inexcusable to make this pandemic into a show of ideology. These recent deaths are on those leaders who have failed to support our general public health recommendations and vaccines, but instead continue to spread misinformation on the vaccine and on the pandemic in general. Our healthcare workers, they are burnt out. They have worked around the clock for 1.5 years. Compassion fatigue is rampant, especially when the patients they care for now were recalcitrant to our pleas to get protected from this frequently serious infection. Yes, we see some breakthrough infections in people who are vaccinated. However, those cases do not end up in the hospital. And these relatively rare cases are not responsible for spreading the virus through our communities. We all have been behaving as if the pandemic was over. That is absolutely not the case. We in Santa Barbara County are now back at the brink of the purple tier and experiencing widespread community transmission by unvaccinated people. Everyone has to come together and take this seriously. The easiest ways to protect ourselves and others are: we need to avoid crowds. We need to reduce travel to essential trips. We need to all wear masks in public indoor settings. And most importantly, we have to work together to motivate and convince our friends, family members, and neighbors who have not yet gotten the vaccine to get it. Instead of lamenting about public health recommendations and perceived restrictions, we need to take responsibility for ourselves, our neighbors, and loved ones. Thank you for your cooperation.
Thank you, Dr. Ansorg and Dr. Dorenoso. At this time, we open it up to questions from the media. First up will be Laura Place with Santa Maria Times.
Good morning, everyone. Thank you, Gina. My first question would be for either Dr. Ansorg or Dr. Dorenoso. With these spiking cases, deaths, hospitalizations, as you mentioned, do you see a need either immediately or in the near future to resume a mask mandate similar to what LA County has in place?
Laura, I do not. The problem with that is that a mandate is only as good as when it's followed. So when I look at pictures from Los Angeles where they did mandate in public indoor settings, mask wearing for everybody. Not everybody follows it. So we want to, in Santa Barbara County, we want to continue with recommendations and pleading for our people to follow those recommendations.
I think the key here, Laura, is that we really need to focus on doing everything possible to get the remaining community members vaccinated. As Dr. Ansorg mentioned earlier, every one of us need to do our part in having those one-on-one conversations, joining hands with our community partners doing the work and joining hands with public health to get the remaining 148,000 people vaccinated.
Okay, and just to clarify, individual businesses though can, if they wanted to, resume mask requirements for all customers inside their businesses, right?
Absolutely.
Okay. And one last question. So I know we've seen most new cases popping up, as you said, among the unvaccinated, but there have been some breakthrough cases, I guess as it's being called, among some vaccinated residents, which isn't surprising since no vaccine is 100% effective. But can you speak to the number of those cases you've seen so far in our county, just to kind of give people an idea of the continued risk even for vaccinated residents?
Yes, as Dr. Do Reynoso showed the graph for last week, and last week, about 20% of all of our cases were in fully vaccinated people. Now, to put it in perspective, none of them ended up in the hospital, and those people who are vaccinated generally experience very minimal symptoms only. Oftentimes no symptoms. So it does not mean that the vaccine is worthless or not working. The vaccine is 100% effective in preventing serious illness and death from COVID. And to 83%, it prevents even milder symptoms. So it is very effective.
Okay, thanks so much.
Thank you, Laura. I'm not quite sure if broadcast media is live right now, but I'm going to go to KSBY, Gina Avalos next. Go ahead, Gina.
Thank you, Gina. Good morning to you all. I have a few questions, but the first one being, we've been seeing, we saw an outbreak here in Santa Maria at the shelter, and I'm just wondering what you guys are doing to kind of manage that and help them out right now.
Our outbreak team has been working in close partnership with the homeless shelter. We not only are providing isolation and quarantine, we are also providing vaccination clinic on site as well to raise the level of vaccinated residents and raise the level of vaccination among staff as well.
Awesome. You definitely answered one of those questions, another of those questions that I have. And then finally, what are vaccine percentages looking like in shelters? Would you say there's been a pushback from residents there?
I think that given the 20% at this particular homeless shelter, there is some hesitancy, definitely. So what we are doing is being on site, and we have also worked at having an on-site vaccination opportunity moving forward so that it is very, very accessible to all residents coming in as well as the staff.
This final question that I have for you, or Dr. Ansorg, is, have we seen any other outbreaks of this magnitude across the county in these past weeks?
We currently have 8 active outbreaks throughout the county, and we do have another outbreak similar in size at a school in South County.
Thank you.
Thank you, Gina. Next up, we're going to go to Ginamura with the Santa Barbara Independent, to be followed by Jade with Newshawk. Jean, go ahead.
Thank you, Gina. And thank you, everybody, for your questions so far. You've answered a lot that I've had. In yesterday's announcement, they talked about the state having a CalVax program that was going to distribute $40 million so that I think private doctors can have one-on-one communications with patients to try to inform them about the vaccine and allay any fears. Do you have any information on that so far? Would that be done through public health or another organization? Do you know?
Yes, so the governor did mention the 40 million CalVax program to support individual doctors' offices. It's on a first come, first serve, and the state is estimating a total of 3,000 providers will qualify. And so this program is created to support community-based physicians to help our state reach its vaccination goals. It is not administered by local health departments. It is administered by Physicians for a Healthy California. They will be running the grants. And again, the individual practices can receive up to $55,000 to support vaccination efforts. And to be eligible, basically, it's a fairly straightforward process where physicians are going on to the state website and applying for it. The program is going to be running from July 12th through August 13th, so a fairly short time period. And our public health nurses have been visiting doctors' offices to share with them about this opportunity and assisting them in any way that they can. So that's what our immunization program has been doing for the past month or so.
Okay, terrific. Thank you, Yvonne.
Thank you, Jean. And now we're going to Jade with Newshawk.
Hi, thank you. So I know that you've said getting vaccinated has, it severely protects against severe disease and illness, but how effective are the vaccines at preventing actual infection, and how likely are vaccinated people to get infected and infect others, even if they don't get sick themselves?
Jade, there is not enough information to make absolutely definite, to have a definitive answer to your question. But what we are seeing so far is that asymptomatic vaccinated people do not seem to spread the virus. The infection percentage will vary depending on how high the vaccination rate in the population is. So for instance, the numbers out of Israel, where they have a vaccination rate in the 90% range, or locally Marin County, where they have a close to 95% vaccination rate, in those counties, the cases that occur are frequently in vaccinated people, but they are mild and they don't end up in the hospital. I hope that answers some of your questions.
Yes, thank you. And then just one more. I was wondering if you or Dr. Del Reynoso could talk a little bit about vaccination efforts for back to school as kids are preparing to start the new school year.
Yes, we are actively engaging with all school districts, with private schools, with the superintendents, and we strongly recommend for everybody who is eligible, and that is children 12 years and older, as well as all staff, to get the vaccine as soon as possible. We have a dedicated outreach team of one nurse for the North County, one nurse for the South County, and a health educator who are exclusively working with our schools and promoting these efforts as well. We have had vaccine clinics at schools, and we would be willing to do this again if the need would be there to give the vaccinations at the schools.
Great, thank you. And that's it.
Thank you, Jade. And next up, we're going to go to Dave Alley with KYT KCOY. Go ahead, Dave.
Yeah, good morning. Can you hear me okay?
We can hear you.
Perfect. Okay. Couple questions. Should any business types be concerned about possible capacity restrictions or even closures at this point? Should numbers continue to go in the wrong direction?
At this point in time, no.
All right. And then we heard about non-essential travel. Obviously, we're still in the heart of vacation season for many people coming, either leaving our area who live here or people coming into our area. What do you say for people that may be heading on vacation here, people that are still have travel plans? What kind of advice do you have to them?
I would strongly recommend to get the vaccine, and I would strongly recommend to be very cautious, especially when it's air travel. Wear the best mask possible, wash your hands frequently, and please get tested upon return. We have a lot of testing opportunity. It is free, and it's available on our website, information in North County, Mid County, South County, everywhere. Get tested upon return, ideally twice, a couple of days after return, and then maybe another 5 days after that again, to be safe that you didn't catch the infection on your trip.
And one last question. We just heard you speak about schools, and you mentioned, the eligibility is only 12 and older. What do you say for parents that have kids that are 11 and below, and how concerned should they be, and what advice do you give them?
The advice for parents who have children younger than 12 is, first of all, the parents should be vaccinated so they don't spread it to their children. That is really important. And then we have a very comprehensive safety protocol for all kindergarten through 12th grade, which involves masking indoors for all children or young people, whether they are vaccinated or not. And we are working with the schools very closely, and we will continue to do so. And that is the best protection those children can have, and the best protection that those parents can give them.
Great, thank you for your time.
Thank you, Dave. And next up, we are going to Lily Lazarus with Santa Barbara Independent.
Hi there, thank you so much. I just have a question for Dr. Do Reynoso. You mentioned numbers coming out of South County at schools. Do you have an estimated head count of how many people are involved in that outbreak?
Yes, so we have a situation where I believe it is 23 students involved.
And is it primarily students, or are there also, teachers involved in the outbreak as well?
It is primarily students.
Great, thank you so much.
Thank you, Lily. And next up, we're going to Atmika Iyer with Daily Nexus.
I hope everyone's having an awesome Tuesday. My question is just, with the Delta variant spreading, is there any possibility of alterations to UCSB and any other colleges in the area's reopening plans for in-person instruction?
Not at this point. I think the guidance for higher education institutions is very comprehensive, and fortunately, the uptake in the vaccine is good. There is still room for improvement, and we are working closely with UCSB and Santa Barbara City College in particular, but also in the North County. We are happy to help as much as we can in getting the students vaccinated.
That's it. Thank you so much.
Thank you, Atmika. Our last three will be KCBX, KCSB, and 2 Tempo Digital. So next we're going to Angel Russell with KCBX.
So I understand from this conversation, the main push is to really get people vaccinated. But as we know, there are a lot of people out there who just, it doesn't matter how much you try to convince them, they're not going to take the vaccine. Say in the case that numbers go to an unpredictable level or things get extreme in a way that it gets pretty bad, would you as a health department consider putting any type of restrictions that we saw during the pandemic when it comes to businesses, masks, or would you solely wait until the governor issued those kind of restrictions?
Great question. It's a dilemma, right? As the public health department, we are getting sleepless nights, frankly, as we are tracking our case rates. But again, I don't want to pivot away from the vaccination efforts. I think that we can do it. We absolutely can do it if every one of us takes up the challenge to do that one-on-one communication with our family and our friends. If employers could take up that mantle as well, I think collectively with all of the efforts, we can move the needle on increasing our vaccinated rates. With regards to restrictions, when we get into the purple tier, I think that we would consider advisories such as masking indoors, avoiding crowds, social distancing, hand washing, everything that we know that has worked in the last 16 months. But what has worked best is, again, vaccination. And so we don't want to let go of that focus. We want to make sure that we don't deviate from that effort.
Angel, did you have any other questions?
No, that's perfect. Thank you.
Thank you so much. Next, we'll be going to Lisa Osborne with KCSB Radio.
Thanks, Gina.
Go ahead, Lisa.
Thanks, Gina, and thank you, doctors, for hosting this today. I was speaking with some business leaders and business owners over the weekend, and they said that they would like you to set the rules for masking. One restaurant owner told me that they don't want to have to be the babysitter to tell their patrons to wear masks because it seems to put extra pressure on the business. I was going to ask what Angel just asked, you know, whether you would at some point step in or whether you were waiting for the state to mandate something, but since you just answered that question, let me ask you, what would you say to these business owners who might be frustrated with needing to enforce the masking rules on top of running their business?
So if our numbers increase and we find ourselves next week, say in the deep purple, what used to be the deep purple, which is excess of 46 cases a day, on a consistent level, we would consider a mask mandate for indoors. And I too have heard from businesses wishing for that mandate. But then I've also heard from community members who are uncomfortable with such a mandate. So we live in a very complex community, very complicated. So I don't think that one size will fit all. But again, as the case rates get us into the danger zone, the deep purple state, I think that we will be having those tough conversations. But I again really want to talk to those business owners and really, for example, applauding Acme Hospitality Group for stepping up and saying, you know what, we will ensure that 100% of our workforce will be vaccinated. And so I think that those efforts by businesses will have a greater return on investment than any masking mandate or recommendation. Because again, it gets into that uncomfortable space of who's going to do the enforcement.
Thank you.
Thank you, Lisa. And now we'll go to Fabiola Navarrete with Two Tiempo Digital.
Yes, hello. Hello, everyone. Okay, my first question is about a death that has been reported, and it was a person between 18 and 29 years, a young person. And we just want to know if you know about this case and if this person had like previous health condition.
This person does not have previous underlying health condition.
Okay. Was this person vaccinated?
No, this person was not vaccinated.
Okay.
This is one of the most sad cases we've had all this time. So our hearts go out to the family and to the friends of this young person who died completely unnecessarily.
Okay, thank you very much. Okay, one more question. This is about our main concern that you just talked about. We know that in April, many people have been vaccinated, like around 1,700 people per day. And now in July, only 93 people. So we know this is our main concern, and we know you are doing all you can now, but do you have some information about what's the main cause of people? Like, we know there's a lot of misinformation, like Dr. Ansor just said, but any other situations that you have heard from people that don't want to get vaccinated?
We've heard there are different categories why people don't get vaccinated. One category is the hardcore, so to speak, anti-vaccination people who are categorically, against vaccination. So we respect their choice, and we are not trying to convince them, quite frankly. The only person who could convince them would be a loved one or a personal doctor or somebody like that. The public health department doesn't see a lot of success there. Then there is a category of people who are concerned about the safety, and that is really those people who are concerned about the safety of the vaccine. They need friends, peers, family members, their doctor, somebody they know and trust, maybe their pastor, to help them being able to express their fears and get valid information, and hopefully it will ease their concerns and they will feel ready to take the vaccine. And then there's a third category, and that's where you and the community hopefully can come in and help. And that is people who just work so hard. Some people work 2 or 3 jobs, and go to school, or have little children, or single parents, and they need support in babysitting or financially or something to be able to take a day off and go and get the vaccine. So that is something we are looking into, and hopefully we can get help to those people.
Okay, thank you so much. And my last question is about the increasing cases in Santa Barbara. As we know, before it was Santa Maria where we saw more cases. Now, do you know why is the main cause of this situation? Are there less people vaccinated there, or maybe the tourism, or do you have some information?
one of the information that we do have is that this is exactly 3 weeks after the 4th of July weekend, where there was a lot of travel and partying going on. And then we also have this outbreak in a school in South County. So we had some extra cases here in Santa Barbara area that were not the case in Santa Maria. So that is probably why there are more cases this time in Santa Barbara than in Santa Maria.
Okay, thank you so much. Keep having a great day, all of you. Thank you.
Thank you, Fabiola. That concludes the questions today and our press conference. County public health experts provide live updates every Thursday at 11 a.m. on KYT News Channel 3. Daily reports are posted on the county's public health data dashboard at publichealthsbc.org. And you can sign up to receive email updates, including the Week in Review snapshot that is issued on Fridays. To sign up for that, go to countyofsb.org and select Join Our Mailing List in the upper right corner of the homepage. We ask the community to remain vigilant and help put an end to the spread of COVID. We thank you for watching today. We thank our public health experts and our interpreters today.